Hi, everyone. My name is Colleen Flynn, and I'm the co-executive director of Build Healthy Places Network. We're a national center fostering cross-sector collaboration across healthcare, public health, and community development to accelerate community-centered investments in racial equity. And this is our popular video series that provides brief insights into the work of practitioners and experts and organizations in the community development, health, and finance sectors working together to make communities healthier. And our current series focuses on centering community voice and uplifts practices, projects, and policies that support community engagement processes that are community-led and owned. And today we're here to talk about the proposed changes to the Affirmatively Furthering Fair Housing rule that the United States Department of Housing and Urban Development is soliciting comments from the public until April 10th. And we think this presents a historic moment for communities that have faced decades of housing exclusion, discrimination to lift up their voices and shape their own future for housing justice. Particular attention, we think public health and healthcare practitioners have an opportunity to help develop fair housing tools to address patterns of social inequities, segregation, and disinvestment that impact health. And Build Healthy Places Network created a useful tool template using policy links, public comment guide, and you can submit your comments and it'll be available on our homepage if you want to check out the template. And I'm delighted to introduce our guest today, Will, the Housing and Justice Program Director at Human Impact Partners. Welcome, Will.
Hi, Colleen. Thanks for having me.
Yeah, it's great to have you here. So if you could just introduce yourself and tell us a little bit about Human Impact Partners.
Sure. I'm the Housing Justice Program Director at Human Impact Partners. And if you're not familiar, Human Impact Partners, and we go by HIP, is a national public health justice nonprofit. We work to transform the field of public health to center equity and then build collective power with social justice movements. And we do that through a number of different strategies. We do organizing within the public health field to build deeper relationships with other movements. So in my work, that's a lot of building relationships between public health and housing justice. We do policy advocacy. We do capacity building with governmental public health to help them center health equity and racial equity. And then we do action-oriented research. And that research is what a lot of people know us from. We have a really deep history and background in health impact assessment and that type of research. And our housing justice program works to make housing a basic right for all people, and to do that through building power with housing justice movements.
Great, thanks, Will. And so as you were talking about, HIP focuses on public health. So why is your organization prioritizing housing justice and the proposed changes to the Affirmatively Furthering Fair Housing rule?
Yeah, so our homes should be places that we can be with our families, that we can find refuge in turbulent times like we're coming through. They should be places that we can put down roots. We should be able to look out the window and see our beloved neighbors or extended family or the park down the street or the school where our kids are getting a great education. And the public health research tells us that these are fundamental human needs, having access to those kinds of things, that they allow us to live healthy lives, and that every person should be able to depend on them. But today we can't. The overtly racist policies of the past, so everything from racially restrictive covenants to redlining, have left us with a legacy of really deeply divided cities. And wealthier, whiter neighborhoods have often continued to exclude BIPOC people and hoard resources. And while many BIPOC neighborhoods have created really strong social, economic, and political networks, racist practices like redlining and mortgage discrimination and disparate government decisions have also shut many of those communities out of beneficial investment. And sometimes we talk about those policies in the past, and there's still, still very much housing discrimination, lending discrimination that's happening every day today. So I want to make sure we're talking about this in the present tense. As well, successive waves of displacement and gentrification have fractured connections and displaced residents further from those schools, the jobs, the health supportive amenities from our families. And the result is really deep racial inequities. And then those in turn drive stark differences in life expectancy and then illness. So the Affirmatively Furthering Fair Housing, and I guarantee I'm going to stumble over saying AFFH at least once today, is a powerful tool, I think, to really undo the grip of white supremacy on our housing system. And the rule creates a process for local jurisdictions and housing authorities to diagnose fair housing issues or unfair housing issues, explore their root causes, and then propose remedies in the creation of an equity plan. And as a result, cities and towns and public housing authorities all around this country will be doing some critical introspection that often they don't do. I mean, some do, many do. Many of our governments are taking really active leadership around racial equity and fair housing. And then developing some concrete steps to combat housing discrimination and make like a fairer housing future for all of us. And I think the most important opportunity here, though, is a chance for tenants and organizers and housing justice movements to get more of a foothold in the planning processes that define the future of their homes and neighborhoods. All too often, and I know I've been a part of many planning processes that intentionally exclude the voices of working class BIPOC communities, or at best tokenize, co-opt, patronize without ever making the changes that people are asking for. I've seen that so many times. In the public health field, we're starting to consolidate around an understanding of power itself as really determining the opportunities we have to be healthy, right? Like we used to talk, I mean, we continue to talk about living conditions, about, healthy living, healthy behaviors. But at the end of the day, things like racism and access to power are really what shape the kinds of neighborhoods, the kind of lives that we're able to live in and have. And we're starting to understand that when we get to make decisions, to self-determine, to plan and vision and dream for ourselves, we do better. It's common sense, but the research is really starting to back that up. And that's not that there's nowhere clearer to see that than in housing. Like, do you and your neighbors have the power to stop the incinerator from being built down the block? To decide what kind of homes are built on the vacant parcel that the city owns? To hold banks responsible for offering good loan to white investors, but only predatory ones for Black families? They should. And I think to get there, we need to build a lot of power and enshrine that power in our government institutions and policies. And I think the promise of a strong affirmatively furthering fair housing rule is that it can create an opening for that kind of power, for that kind of organizing, because a strong rule tells cities that, yes, they really do need to create an open and participatory process and really listen to communities, and a strong rule ties HUD funding and oversight to those concrete actions that they identify in their equity plans. I mean, that said, organizing capacity and priorities vary a lot place to place, but I think where there's the infrastructure and where there's the interest, there's potential to really make some big wins through the affirmatively furthering fair housing process and really enshrine community priorities into something that has some teeth and that flows then into other plans and investments that the cities or counties or public housing authorities make.
Yeah, well, so you were talking a bit about deepening community voice and power and thinking about how AFFH rule can help to think about some anti-racist policies as well and strategies. So could you talk a little bit more about the recommendations that HIP is providing in their comments back to HUD?
Sure, yeah. So I think this rule is going to be successful to the extent that it supports the self-determination of BIPOC communities, working class communities, of renters, of racial justice movements, and then the organizations that those communities have really built and led. And anything else, I want to be very clear, anything else will result in, at best, plans that sit on a shelf somewhere, or at worst, really actively sabotaging racial and housing justice efforts. Our recommendations, and these are recommendations that are coming from HIP, but also from a number of other public health organizations across the country. We're echoing those from the Alliance for Housing Justice, which calls for the people most impacted by housing discrimination and poor housing conditions to be in the driver's seat, and that the rule should specifically call that out in the community engagement section, like make that very, very clear about who cities and counties and public housing authorities really need to prioritize the voices of. For those of us within public health, like we see an additional opportunity to encourage the participation of public health departments in the process, and then draw data also from things like community health assessments and improvement plans to make sure that we're building on the community engagement that we're doing in the public health field as well. The Alliance for Housing Justice is also encouraging HUD to ensure that jurisdictions analyze and remedy the full range of housing conditions that communities are naming as priorities. That's things from discrimination to eviction to rents that are impossible to afford to not enough housing in the first place. And so our letter really backs up that demand as well, to make sure the analysis is actually like comprehensive and therefore that the solutions are comprehensive. And I talked earlier about how those of us in public health are really starting to understand power itself as an important force shaping health conditions. And the proposed rule does a great job of calling on jurisdictions to analyze and improve conditions that shape opportunity and health. So things that I've named before, like transportation or parks or schools. But as written, it doesn't necessarily have a place for social and political networks. Those are really the muscles of self-determination and of mutual support. The soft infrastructure that allows communities to really flex their power, and where we can keep each other safe. And so we'd love to see the rule also consider those analysis and action on those kind of issues as well.
Thanks, Will. And so what can other public health related organizations do to engage in this process?
Yeah, I think there's some really concrete ways to plug in. So the simplest one, and this is self-serving, but is to sign the joint sign-on letter from public health organizations that we're helping build momentum around. Those are based on our own reading of the rule, but also draw analysis from the Alliance for Housing Justice and Policy Links comment guide. And that guide and Policy Links work in general, I think, is a great place to start and get more context for the issue. So I just want to lift up their work here. And then you can also write your own letter, and Build Healthy Places Network has an excellent template that you can use based partly on that comment guide as well. And I want to say very explicitly that you are welcome to borrow any and all language you want from our letter. So as you're using that template, if you want to write your own letter, but you don't want to write your own letter, feel free to just cut and paste. I've explicitly said that. And then lastly, you should take 30 seconds and sign on the petition from the Alliance for Housing Justice. And we'll make sure that you have the links to all these things when you go to take action.
Yeah, we'll provide all these links with the video. So thank you so much for your time, Will. It was a pleasure talking with you. And yeah, I'm excited to see what happens next with this rule. Thank you.
Of course. Thank you so much for having me.